Namaskar and a very warm welcome to this edition of our live program, Let's Talk Health Urology Queries. I'm Nidhi Kumar and you're watching India Science. As COVID 19 continues to surge across the globe, there are queries on the go. People are speculating about health problems, and we bring you urology queries today. In this program, we take your questions from Facebook and YouTube Live, and we are joined today by the very well known Dr. Dushyant Nadar, Director HOD Urology at the Fortis Hospital, Noida. Namaskar and welcome.
Namaskar. Good
Thank you
afternoon.
for coming on India Science. We're privileged. Please tell us,
Pleasure is
doctor,
mine.
to begin with, about the current urological scenario in India in view of the new viruses that have come, and how do you prioritize urological management at times like these? What are the specific protocols?
See, the only thing COVID has changed in terms of the virus infecting the kidney and causing a urological problem, except for frequency and urgency that we saw in a lot of patients. The main problem urologists faced in this COVID era was postponement of the urinary problem that basically patients had in terms of stones, in terms of cancers, and acute urinary problem that were created in ICU setups. So that was a major challenge for the urologist, basically in the COVID times. If I had kidney tumor and I knew prior to COVID that it is a 1 centimeter kidney tumor, and I was scared to go to the hospital because of COVID, so I postponed the problem, and a resectable disease had become unresectable, or a 1 centimeter bladder tumor had grown to 5 centimeter after 5 months or in a year. That was a major dilemma that urologists faced in the COVID era.
Right, doctor. Would you tell us about urology? What are the kind of specific diseases that we have? I want a larger picture and an insight to give to the viewers.
Urology is basically it's a surgical part of nephrology. That is a kidney science, a renal science. What we say. I'm a surgical specialist as a nephrologist is a medical specialist. Basic urological problem we deal with the surgical aspect of the kidney in terms of it can be a infection issues, what we say infective things like a kidney infection or a bladder infection or urinary infections, and second it can be malignancies, kidney cancers, cancers of the prostate, cancer of the bladders, and penile cancers. Second, third, it can be commonest things would be something like a stone, kidney stones, and all the stones that are associated in the urinary tract, and of course all that reconstructive in the sense of some urinary issues that caused by blockage of the ureter or blockage in the urinary passage that's called stricture urethra, that basically comes into what we say reconstructive urology. And then the pediatric part, suppose I'm born with a blocked kidney that is called the PUJ obstruction, or a malformed or maldeveloped bladder, or a malformed a urinary tract that's called hypospadias. That basically these are terms that are basically dealt by the urologist, a surgical part of the kidney.
So,
Of course,
supposing I'm
transplant.
born with a urological disorder, like you just mentioned, what are those type of disorders and are they treatable, doctor?
Yes, commonly these disorders are diagnosed at the time what we say prenatal examination of the mother. And once the treating gynecologist is very careful about the health of the kidney, so these kids are followed up closely in the postnatal period. And of course, suppose commonest thing we see is a what we say PUJ obstruction, is a blockage, partial or a complete blockage in one of the urinary tract, which can be closely monitored or it can be surgically treated as per the need be and as per the investigation show. Yes, they do require a close monitoring by the by the gynecologist, and then the follow up by a urologist in a postnatal period.
Meaning after the baby is a certain age, or it can be done in the early stages as well. You mentioned
No,
surgery.
if the blockage is very severe, yes, they can be offered surgery immediately after 2 months or after a month also. But in case of a partial blockages, we follow these kids very, very carefully in terms of a basic ultrasound that can be done after 6 weeks and then 3 months. And of course, later on, slowly, you follow these kidneys and they can be offered surgery at a later age.
Right, doctor. Tell us about the symptoms of kidney stones. What kind of pain does a patient sort of go through?
The commonest symptom for a kidney stone would be a severe unrelenting pain, commonly occurs late in the night, and bleeding urination or severe pain in the back coming to the front. They or may not be accompanied with high grade fevers, frequency, urinary frequency. Common symptom would be again a pain and bleeding in the urinary tract.
Doctor, what is the management of kidney stones now, specifically?
It all depends upon the location of the stone and the size of the stone. So if you have a kidney stone in terms of size, if you talk about, suppose we are talking about only of the kidney stone, which is not moved from the kidney into the urinary passage, that's called as ureter. A stone of around 2 centimeters or more requires a small puncture through the kidney and be taken off by what we procedure called as PCNL, or a what we say mini perk. That's the latest, where we insert a very small tube in the kidney, break it with a laser, and take all the stones out. Among the non-invasive things would be lithotripsy. That's still not too prevalent at this era of lasers, but yes, for a stone size of around 1 centimeter or so, a softer stone that is proven on a CT scan can be tackled by lithotripsy. Second, a stone of the size around 8 millimeter, 9 millimeter, or a 1 centimeter stone, a bit softish on a CT scan, and it can easily be tackled by a what we say retrograde laser, that's called RIRS, retrograde intrarenal surgery. That is the latest in terms of removal of the kidney stones, and the stones that travel down in the ureters. Of course, we have miniaturization of the endoscopes, and in terms of ureteroscope size that we used to have around 7 millimeter or so, now we deal with 4.5 millimeter ureteroscopes, and these stones can be tackled easily by these things.
What, according to you, is endoscopy, doctor? You just mentioned it
See,
for the layman.
any examination of an internal organ by putting a scope is called endoscopy. That endoscopy is usually done by a gastroenterologist, and endoscopic in terms of urinary tract would require a putting of a endoscope in the urinary tract under anesthesia, which can be under local anesthesia or general anesthesia or a spinal anesthesia, and examination of the urinary tract, which can be diagnostic in terms of, suppose you have a bleeding and I have to put a endoscope in the urinary tract to see whether your how your bladder looks, or how is your prostate, or if you have a bladder tumor, I have to biopsy it. So examination of the tract by putting endoscope is called endoscopy.
Right, doctor. Now, how can we prevent kidney stones formation?
So, see, the biggest thing in kidney stone is the reason why somebody forms a kidney stone. 80% people form kidney stones because of what we say a idiopathic reason. The reason is unknown. So, can we really prevent kidney stones? Not really. If we lie in that 80%, we cannot prevent it because we don't know the cause. But of course, suppose you have a genetic predisposition to formation of kidney stone. You live in a temperate climate where you had a small stone around 5 years back. So, drinking more water, if your kidney allows, if you are miserly in terms of water drinking, you should drink more water. Take care of health. Now, obesity has come as an independent risk factor for the formation of kidney stones. Reduce your weight, take a low salt diet, don't go in for a very high protein rich diet in case you have a predisposition for a kidney stones. And of course, early intervention in terms of investigation. Suppose I have severe pain in the back in the night, rather than postponing the investigation, I can go to any urologist, get an ultrasound, and have a look what is happening. And second is the genetic predisposition. Suppose you are a recurrent stone former and you form stones every 6 months, 8 months, to kindly get yourself investigated in terms of what we say we do a 24-hour analysis of the urine and the blood to see whether we have or you have a certain medical illness in terms of something like what was nephrocalcinosis, or what we say a 24 hours. Some people exceed more calcium in the urine. That these things 20% can be tackled by medicines.
Right, doctor. Please tell us why a lot of people have urinary tract infections. What is the cause? And they keep having recurring ones, especially in
See,
women.
urinary infection is in terms of age is the reason is very different. In a younger kid, certain genetic predisposing things like what we say reflux, Certain kids can pass because of a defective valve mechanism. They can pass urine from bladder to kidney. That's called the reflux, and this predisposes them to recurrent urine infections, specifically in girl childs. So if you're a small child, or if you're small children, if they develop a high grade fever, where even a single episode of a high grade fever with a strong suspicion for urinary tract, you should definitely consult a urologist or a pediatric urologist to investigate those reasons that are surgically correctable or have to be closely monitored in terms of urine infection. When you come to younger age, suppose teens or early 20s, commonly urine infections are acquired because of what we say is STDs, sexually transmitted disease. At a later age, around 30s or 40s, early 50s, certain blockages in the urinary tract, more in terms of a prostatic or something like a physical obstruction in terms of what we say stricture urethra. They predispose men to these urinary infections. And of course, certain ladies are more prone to have UTIs. In a younger age, of course, sexually transmitted disease, and at a later age, postponement of urination, then diabetes, and all these factors like having a stone, not being able to pass urine completely, coming to certain urinary tract infection that ladies get predisposed is because uterine problems. You have a bladder that bulges out of the urinary tract, that's called cystoscopy. All these things can make a lady more prone to urinary tract infections.
What about menopause? Does that also have any bearing with this?
Yes, postmenopausal ladies will have a hormone imbalance that will put them at more risk towards a certain urinary infection. And specifically, I have seen Nidhi ji, certain ladies have that tendency of cleaning that urinary tract by a high-speed jet every time they go to a pass urine. So that is a misconception. People feel ki urine is an infective, material, which is not. Urine is as sterile as a cerebrospinal fluid. So every time, and the smell of the urine is not because of infection; it is because of all that chemical composition, that urea that comes out, and all that chemical composition causes that smell. So ladies, they feel every time they go and pass urine, they should wash it with minimal of a jet or use lot of water after every urination. In fact, that is not good. That puts them at more risk to have urinary infections, because in the urinary tract in a lady, the genital tract is very close by, and these areas are teeming with bacteria that are living harmoniously with each other. So if you try to wash those areas with jets or use high pressure jets, which kill these normal bacteria which prevent urinary infections. So these habits should be avoided basically in ladies.
I think they're very prevalent habits. So what you said is absolutely correct. Doctor, you mentioned smell, and I would also like to add to this burning sensation during urination is a common problem among women. Would you like to please tell us more?
Yes, burning can be because of a disease. It can be because of infection. Burning can be because of a blockage that is called urethral stenosis. Burning can be postmenopausal. There's certain glands in the urinary tract, they get infected, which is not exactly part of urinary infection, but these glands that can get infected, and then these burning sensation can be more in these ladies. And then there's certain diseases called as interstitial cystitis. It is a painful bladder syndrome which is not related to infection at all. So most of these patients who come to us have a long history of taking a lot of antibiotics, and then also they don't get rid of these painful bladder syndromes. This basically causes severe pain while passing urine, frequency, urgency, pain in the lower abdomen while passing, and so much so that they can have that depression out of the pain. So in fact, it is not an infection. It is a inflammatory thing in the bladder that causes this symptoms to happen. So basically, you require a basic urologic investigation and examination by urologist, and they can be tackled.
Right, doctor. Interestingly, there is another side to it also. There are some people who have inability to control urine or incontinence, as it's called. Would you like to share more details about this?
See, urgency and frequency can be a part of a urological problem. In fact, 30% to 40% people of a elderly population of a geriatric age group who visit a urology OPD are because of these urgency and frequency issues. And the main problem with this urgency frequency issue is, once you have these, you are a social outcast for yourself. You don't go to visit temples, you don't go to a birthday parties, you don't attend marriage functions because your life revolves around these urgency and frequency of urination. You're too embarrassed to visit somebody. And fortunately, you are born in an era where they can be treated. They just require an investigation to see what kind of urgency do you have. Is it a mixed urgency, or what we say it is a plain only simple urgency? And again, coming to urgency, they can be harbinger of a severe disease in the bladder. Even certain bladder tumors and a prostatic malignancy just present like only urgency frequency. So you should get them investigated, and this is a treatable problem. There are certain very good medicines available that are that form a very good treatment part in terms of urgency.
Doctor, what is a renal transplant and what kind of advances are we seeing in this field? If you could throw no more light on this.
See, transplant the basic function of the kidney is to take out all the excretory product from the body and to throw them out of the body so that we can live happily, healthily. So kidney is basically a filter. Now, so imagine a scenario when your filters are lost. These are called as end-stage renal disease. Once you have end-stage renal disease classified by a certain loss in a glomerular function, though the only way to treat would be first either you come to a dialysis if your kidneys which have got a good excretion for these harmful things and your filters are lost, so you have an artificial filter in terms of dialysis. Second would be suppose and second would be a transplant. When somebody, a donor, gives his kidney to a recipient, and instead of going for dialysis, he goes for a transplant. So that is the basically renal failure and the treatment, either dialysis or a transplant. That not too much advancement in terms of the technicality of surgery in a transplant, except in a surgical part where the patient used to have a long incisions for a kidney donation. We do nowadays, we every transplant is done laparoscopically. So instead of having a big incision that goes right to the flank, we just put a small incision and the kidney is harvested and put in the recipient. And second advancement is in terms of very good immunosuppression. So the rejection rate around 20 years back, where it was around 15% or 20%, now we encounter a rejection rate of around only 1 to 2% in a year, and the survival for at least 75 to 80% for a 5 to 6 years. So that is a beauty of the kidney transplant, and that is the advancement of kidney transplant in this era. The future, probably the lot of work going on in terms of a artificial kidney, or what we say xenotransplant. Recently surgeons have operated, or rather have put a pig, harvested pig heart in two people, where the hearts are working quite fine in one of them. So maybe the future again belongs to what we say xenotransplant, where we can have a genetically modified pigs, and we can take the kidneys out and implant them in humans. That would rather take care of the severe deficit that a transplant surgeon faces nowadays in terms of getting a organ for kidney transplant.
Yes, we'll talk about this later. Meanwhile, we have a question coming from Khushbu Pandey. Thank you for your question. She says, please share the hygiene practices and care that should prevent UTI in girls and women.
So you should not be, too much obsessive about cleanliness of that area. That I would say, Kushbu. Every time that you go and pass urine, preferably everybody nowadays has got clean toilets. So you should not be obsessive about cleaning that area with a jet of water. I think a simple dab would do, and general hygiene. If you say somebody does not take a bath for 5 days and he does clean that urinary area every time he goes to pass urine, I would rather say have a good hygiene, go take a bath once in a day or twice in a day. And just while you pass urine, you can, if you feel dirty about passing urine, you can dab it with a tissue instead of washing that area with lot of douches and lot of jets and all the sprays. That should not. And general hygiene would do. You don't require anything special in terms of a urological hygiene.
Doctor, does a cystoscopy hurt? What is it actually?
See, cystoscopy is examination of the urinary tract by putting an endoscope inside. Yes, in case you get it done without anesthesia, it's going to hurt terribly because body that area is very very sensitive in terms of the nerve supply given by nature. So it's a very small endoscope that is passed in the urinary tract for either diagnosis or either for the treatment. And commonly it is done, rather, it is always done under a local anesthesia or a short anesthesia. So it is not painful.
Doctor, what are the precautions to be taken by a patient who's just had a renal transplant?
First of all, he should, take care of hygiene. He should have a home cooked food. He should have a water supply, which minimal comes by RO, or in case he does not have a facility for RO, he should boil that water. He should take his medicine regularly. He can miss a meal, but he cannot miss the medicine. That is a norm. He has to visit the nephrologist or a transplant surgeon, whoever is taking care of him, as per schedule, and he should follow all that investigation that are recommended by the nephrologist. We have a schedule every week in the first 3 months, and then first month rather, any 15 days in the next 3 months. And basically home cooked food, keeping away from all that patients and visitors who come with infection or sore throat. Put a mask once he goes out. That is all.
Doctor, tell us.
Otherwise, come,
Yes.
sorry to interrupt, but what I want to tell you is ki, once after the transplant, the norm is ki, keep them confined, locked in the room, don't let them meet anybody. That is not true. Once you have the transplant, and it is a beautiful surgery in terms of giving a life to somebody, and the dramatic change that somebody has after transplant is not, is to be seen to believe. They can live a normal life like anybody else. Only thing is they can take care of the diet. Otherwise, uh, it is a normal life.
Doctor, there's so many patients who are advised dialysis in hospitals, and they keep visiting hospitals day after day. How long should there be an interval between various dialysis, or it can be continuous? And why is it so expensive, doctor?
Uh, I may not be the best person to answer because I'm a urologist, but since I'm a transplant surgeon also, so once you have end stage renal disease, so you have to go for a dialysis definitely. The usual schedule is the every third day commonly, so patients come twice in a week, depending upon, of course, their potassium levels or their weight, or usually the necessities as per the nephrologist. And yes, dialysis is permanent. So once you are classified as end-stage renal disease, you need to have a dialysis. It can be either hemodialysis, what we say is on the machine, or it can be something like what we say continuous peritoneal dialysis, where you insert a small tube in the stomach in the abdomen, and the patient can do a dialysis himself in his home settings. So it's a very easy thing to learn, and many patients in a home setting are having this dialysis facility that is called as peritoneal dialysis. But yes, it is permanent. And coming to your last question, is it expensive? Yes, it is expensive. And thankfully, there's a lot of government support and lot of support by these voluntary organizations where the cost of treatment has reduced, the cost of dialysate what is reduced. And the biggest answer to this would be transplant. So India, the maximum people who uh, have renal failure in a given month are young adults, in terms of in the range of 20s or 30s. So once these patients are counseled for a transplant, so transplant would give them the best life, and the cost of transplant is much less compared to a dialysis if you talk in terms of 5 years or 10 years.
Doctor, what is the management of kidney failure? What exactly is kidney failure? And what are the recent advances? Because it is difficult to get an organ, and I mean, it is your relative who needs to give you something like that, I understand.
Nidhi, I think in terms of yes, yeah, there's deficiency. We have a deficiency of maybe 2 lakh to 3 lakh in a year. People who have renal failure and who would require a transplant. So, the of course, answering your first question, key once you have a renal failure, so it is defined as, if your the filtration rate goes below a certain amount, you are classified as end stage renal disease. And once you are classified as end stage renal disease, it does not recover. So a temporary thing like what we say acute kidney failure or acute kidney injury might recover after 3 to 4 weeks or 2 months, but a end stage renal disease never recovers. So the only option would be a dialysis or a renal transplantation. And the future of transplant is all dependent upon the availability of donors and availability of donors. Unfortunately, India, specifically in the northern India, this paucity of organs is it is terrific, and most of our donors are family donors only, because that's the way the law goes about it. So near the future will belong to a cadaveric transplant. So cadaver transplant is a brain dead donor. Suppose, unfortunately, suppose a young adult has a aneurysm bleed and he has a brain dead, and the relatives are counseled and they are very much enthusiastic about giving life to people. Of course, their brother or their kid has died, and they would like to rather not exactly reduce the grief, but they can give this life to five more different people in heart, in terms of lungs, in terms of two kidneys, intestines. So it is basically giving life to somebody. That would be the future in transplant.
Absolutely, and maybe robotic also, which is coming in now genetically and robotically. We are having transplants across the world
Yes,
in
robotic
Asia.
just reduces, the incision site. Otherwise, it is just like a it is only a laparoscopic surgery. The future definitely can be a xenograft, where genetically modified pigs can reduce the burden of the donor pool. Yeah, definitely it should be there.
Doctor, tell us about cancers of the urinary tract and how are they treatable? What kind of cancers can one see?
If you start from the kidney, then you have commonest cancer is a kidney cancer. Then coming down, it can be a urinary cancer and bladder cancer and prostate. Kidney cancers are more towards a younger population in terms of between 30 to 50s, and commonest would be a kidney, and of course what we see nowadays is a prostatic cancer. The treatment is dependent upon again the stage. The early stage kidney cancers can be where we have a size that is smaller, present only in one kidney or both the kidneys with a smaller size. So they can be treated without removal of the whole kidney laparoscopically or robotically. And coming down, if you say you have a bladder tumor which presents like bleeding, the treatment again would be depending upon the stage. If you have an early stage, you conserve the bladder, and you have a which is what we say muscle invasive disease, you remove the bladder or create an artificial bladder or a small tube that comes out of the abdomen, that is called a conduit. Coming to the prostate cancer, it's again dependent upon the grade and the stage. Early stage prostatic cancer can be treated by surgically or by radiation, and later stage cancer of the prostate is usually treated by hormone with or without radiation.
Right, doctor. Another question that is coming up since we have less time is there's blood in the urine. What could be the cause?
There are hundreds of cause of having blood in the urine. If you have a bleeding that is painless, I would just request you to go to any urologist. Basically, definitely have an ultrasound just to see whether it's a simple stone that is causing bleeding or there's something else. It would definitely require a ultrasound minimum, and depending upon the need be and the investigation wise, if urologist feels that it requires a CT scan, kindly go ahead, trust your doctor, get it done.
Doctor, is there an alternative to cystoscopy?
Yeah, not exactly. Cystoscopy is rather, step B. Preceding cystoscopy, commonly I would say ultrasound should be done. But is ultrasound replacement for cystoscopy? No, it is not. Both are absolutely different investigation for a wide different spectrum.
Absolutely. And in the end, I'd like to thank you, Dr. Dushyant, for sparing us your valuable time and for educating us. And with this, friends, this is a wrap of this edition of Let's Talk Health. We'll be back with more interesting episodes. Till then, keep that mask up, stay safe, and namaskar. Thank you for watching India Science.
Thank you, ma'am. Thank you again.